All right, so today we're going to be doing an assessment of the respiratory, cardiovascular, and peripheral vascular system. So we're going to head right to the respiratory system first. So we're going to start on the front here. First thing I'm going to do is be looking at the patient's face, and I'm looking for any signs of poor oxygenation, like restlessness or anxiety. I'm looking for any cyanosis of her lips, anything like that. And I'm going to move down and I'm going to look at her trachea, making sure that her trachea is midline. From there, we're going to go ahead and turn around and move on to the back. So I'm going to have the patient cross her arms and put her hands on her shoulders. So the first thing we're doing is inspecting, of course. I'm looking at her skin. I'm looking at the shape and symmetry of her posterior thorax. I'm looking at her respiratory movement to make sure there's not lag on one side or an impairment on one side. And I'm also looking to make sure that there's no retractions. I don't see any of that stuff. So we'll move into palpation. And I'm going to start just palpating. I'm looking for any abnormalities, any masses or pain. So I just kind of start up here and feel down. Any pain? No, I didn't feel any masses or anything. We'll move right into testing her chest expansion. What I'm going to do is go down to the T10 area and pinch some skin together, and the patient will breathe, and I'm looking for smooth, even movement. So about right here. Deep breath for me. Yeah. Had that nice, smooth, even movement. We'll move from there into checking for tactile fremitus. So what I'm going to do is have the patient say 99. I'm going to feel down all the way to the bases, looking for equal both sides. I'm going to use my palms for this one. Repeat 99 for me.
99, 99, 99, 99, 99.
All right, and it was equal on both sides, equal vibration on both sides. Decreases a little bit when it gets to the bases, but that's normal. You can use your ulnar surface also, so I use that at the bottom. So from there, I'm going to move into percussion, and what we're looking for here is resonance that denotes normal aeration. Make sure there's no hyperresonance or dullness. So I'm going to start up here. Obviously hard to get on the spots because of the sports bra. From there, I'm going to move into auscultation. So I'm going to listen with the diaphragm of my stethoscope. I'm going to have the patient take deep breaths in and out of their mouth. Okay. All right, you're going to listen through each inspiration and expiration all the way. She was equal and clear bilaterally. So from there, we're going to move into transmitted breath sounds, listening for any consolidation. So we're going to do egophony. So I'm going to have her repeat E, and I'll be looking to hear that muffled E sound. And if it turns to an A or a ba, that would denote consolidation.
E, 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 E.
All right, no consolidation. We'll have her turn around to the front. Start the same thing with inspection. Looking for any retractions. I'm looking at the shape and symmetry. Make sure that her respiratory movement is equal. And I'm looking at her skin. And I can see all that stuff. is normal. So I'll go ahead and move into palpation. So same thing as the back with palpation, just feeling for any abnormalities or any pain. So I'd palpate down. Obviously, I will go all the way down, checking for those things. And then I would move into tactile fermentus on the front too. I'll use my ulnar surfaces this time. All right, 99.
99, 99, 99, 99,
And pick your arms up for me.
99, 99.
All right, it was equal both sides, decreasing a little bit at the bases. From there, we'll move on to percussion. So in the interest of decency, on the front, we'll just percuss and palpate on the top two, but of course we would do everything like we did on the back normally. All right, and then we'll go ahead and do tactile fermentus on the front. So we're going to have her do, oh actually I'm sorry, we already did that. We'll move into auscultation now. So I'm gonna listen with the diaphragm, my stethoscope, and we'll just do the top two up here. Breathing in and out your mouth. All right, equal bilateral, clear, no adventitious sounds or anything. So from there, we'll move right to the cardiovascular system. So first thing I'm doing is looking at her face again. Make sure there's no signs of cardiovascular problems, periorbital edema, any cyanosis or anything like that. I don't see anything like that. I'll move down. First thing I'm going to do is palpate her carotid. Normally you do both sides. You're checking for amplitude, equal, all that stuff, but we're just going to do one side here. I don't feel any thrills, but I'm going to listen with the bell of my stethoscope here. Hold your breath. And breathe. All right, so no bruit. So we'll move, we're not going to do JVP for this assessment, but I know if I was doing it, the patient would be at a 45-degree angle, and I'd have them turn their head to the right so that I can check that. So we'll move straight into inspection. So for the cardiovascular system, the 5 major land points, or landmarks, I'm sorry, would be the aortic, which is the second intercostal space on the right sternal border. The pulmonic is the second intercostal space on the left sternal border. The Erb's point is the third intercostal space on the left sternal border. The tricuspid is the fourth intercostal space, left sternal border. And then the mitral is midclavicular, fifth intercostal space. So we're going to inspect. We're looking for any heaves or pulsations. I don't see any of that stuff. So we're going to palpate with our pads, with the pad of my fingers and with the palm of my hand, feeling for any thrill or anything like that. So I'm just going to feel. All right, I don't feel anything there. So we'll go from there straight into auscultation. So I'm going to start with the diaphragm, my stethoscope, which is better for listening to higher pitched tones like S1, S2, murmurs and stuff of that nature. So just in the interest of decency, I'm not going to be able to do the mitral on her, but typically I would. Also, I forgot to mention during palpation, which I won't be able to do on her, as well as the PMI, but you would feel for that point of maximal impulse, and you just verify that it wasn't bigger than a quarter. So now I'll move on to listening with the bell of my stethoscope. So this is going to be for lower pitch tones like S3, S4. All right, everything sounds normal. So that will conclude the cardiovascular system. We'll move straight on to the peripheral vascular system. So the first thing I'm going to do is palpate her lymph nodes. I'm going to do the clavicular, axillary, and the trochlear. So we'll just start feeling up here. See if we can palpate them, make sure they feel normal. Don't feel any up there. Go into the axillary. Nothing down there. The trochlear. Non-palpable there. So I'm going to do her arms first. I'm just going to inspect the skin, and I'm looking for symmetry, any abnormalities, or any edema. I don't see any of that stuff. I'm going to feel the temperature, the backs of my hands, all warm. I'm just going to palpate, make sure there's no pain, tenderness, and also looking for edema. Don't see any of that. I'm going to check her radial pulses and make sure they're equal bilaterally. They are 2+, and I'm going to check her capillary refill. Just going to give a squeeze here, looking for less than 2 seconds, and hers was. Move on to her legs, same thing, inspecting skin, size and symmetry, making sure there's no edema. Palpate for edema or any pain. Don't see any. I'd feel temperature, backs of my hands, feel warm. I have her kick her feet up. I don't know if you can see this, but I'm gonna. I would feel her dorsal pedal pulses. They're on the top of her feet, and again, just making sure that they're equal bilateral. They are. And then I would check cap refill on her toe. Less than 2 seconds. And that concludes our assessment of respiratory, cardiovascular, and peripheral vascular system.